Every year, harmful use of alcohol is responsible for 3 million deaths and 5% of the global health burden, from road traffic injuries to violence, abuse and neglect, to diseases like liver cirrhosis, heart disease, cancers and tuberculosis, to mental health issues like alcohol dependence, depression and suicides. But what can we do about it? Well, the WHO's global strategy, endorsed by member states, aims to reduce the harmful use of alcohol. Unfortunately, implementation of the strategy is uneven. Meet Nina. In her country, there are very few government regulations on drinking. Nina is out with a friend. The alcohol is cheaper than bottled water, and the bar stays open till 4 AM, so people are encouraged to stay out late and drink more. Nina's friend falls and hurts herself. Now meet Amya. Her government has introduced pricing measures on alcohol, and there's a mandatory closing time for bars, which means Amya and her friend leave for home at midnight. Amya decides to take a taxi, because the police in her country are very active in enforcing drink driving countermeasures. But in Nina's country, the police don't enforce drink driving laws at all, so she decides to drive her friend home. She is way over the limit and crashes her car. Nina and her friend are taken to hospital, using up the time and resources of busy nurses and doctors. Nina's injuries aren't serious, and once they're patched up, she is released immediately. But when she gets home, she is told that her friend died in the car crash. In Amya's country, if people display signs of problems with drinking alcohol, they are offered help early. Amya's country also has restrictions on alcohol advertising, unlike Nina's, where young people can be persuaded to drink to excess by cleverly targeted commercials. If governments implement the WHO's Safer initiative, they can change people's relationship with alcohol, making our world less like Nina's and more like Amya's. Be safer. Strengthening restrictions on alcohol availability. Advancing and enforcing drink driving countermeasures. Facilitating access to screening, brief interventions and treatment. Enforcing restrictions on alcohol advertising. Raising prices on alcohol through taxes and pricing policies. Safer is a WHO-led initiative that follows the global strategy to make our world safer from alcohol-related harm.